Bill, this is an X-ray of your colon or large intestine. This is your right, and this is the left. And I want to do flexible sigmoidoscopy to examine this area of the colon where this spasm is, where this narrowing is. This is where you're having your pain.
Flexible sigmoidoscopy is a procedure that will allow your doctor to examine the lower portion of your colon. To understand how this test is done, it is important to look at how the lower digestive tract works. The lower digestive tract consists of two major sections: the colon, or large bowel, the lower portion of which is called the sigmoid, and the rectum. Body wastes accumulate in the colon and leave the body through the rectum. Common problems with the lower digestive tract include pain, diarrhea, and bleeding. Other things your doctor may check for are an inflamed bowel or polyps. Polyps are small mushroom-like growths that sometimes form on the lining of the colon. If left untreated, the polyps can become cancerous. In order to view the lower intestinal tract, your doctor will use a device called a flexible sigmoidoscope. The sigmoidoscope uses bundles of extremely thin and flexible glass fibers, called fiber optics, to light and view the inside of the colon. When the tube of the scope is guided through your colon, the doctor is able to inspect all the parts of the large bowel in detail. With its controls, your doctor is able to turn the tip of the scope in any direction to aid in his examination.
Bill, do you have any other questions about this procedure?
Well, does it hurt?
That's a good question, obviously. No, it really doesn't. It's not painful. It's very normal to have a full sensation as if one has to move their bowels. That's the usual reaction, but it isn't really painful.
Well, how will I feel afterwards?
There may be some bloating. You may feel somewhat bloated or distended. This will resolve quickly so that there really aren't any long-term side effects at all. It's a very safe procedure.
The risks involved, while minimal, include the very slight chance that the instrument could cause a tear in the colon. And if a biopsy is taken, there is the risk of bleeding. Your preparation for the sigmoidoscope exam is extremely important. The objective is to completely empty your lower bowel of stool before the exam. The reason is simple. The flexible sigmoidoscope cannot see through stool. So if your bowel is not clean, the doctor will be unable to carry out the examination. Cleansing preparations may differ depending on your doctor's preference. But in most cases, you'll be told to use 2 disposable enemas the day of the test. Sigmoidoscopy can be done either in a hospital or your doctor's office. The exam usually takes from 10 to 20 minutes. After examining the rectum with a glove, the lubricated tip of the scope is inserted into the rectum. A flow of air inflates the passage and keeps it open for clear viewing as the tube is carefully guided throughout the bowel. During the exam, it is important that you communicate any discomfort you may feel. Your comments will help your doctor maneuver the sigmoidoscope around the bowel.
I think I will take a biopsy of that area just to make sure there's no inflammation there. So we'll just stop for a minute. It won't be painful. You won't feel anything. You'll just feel a slight tugging sensation.
If during the procedure either ulcers or polyps are found, your doctor may take a small sample of tissue from the lining for a biopsy.
Okay. You'll feel just a slight tugging as we do this. Close.
This doesn't necessarily mean that your doctor suspects cancer. For example, he may take a sample of the lining if it looks irritated.
Bill?
At the completion of the examination, your doctor will discuss the results of the procedure with you.
Let's get dressed, and I will see you back in a room in just a few minutes. Okay?
Okay.
Bill, we got a good chance to look at that area. It looks entirely normal. There are really no polyps or tumors.
There are some minor side effects which you may experience after the exam. These include a bloated feeling, mild cramps, gas, and possibly a small spotting of blood in the stool. Normally, all of these side effects will disappear within 24 hours. However, if they persist, or become more severe, call your doctor. If you are over the age of 40, your doctor may recommend this procedure every 3 to 5 years. As a diagnostic tool, sigmoidoscopy is a safe and useful procedure, one in which you should have the utmost confidence.